I think what we're going to see is essentially refinements of some of these older technologies that have been around and that have been essentially seeing some benefits.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. This episode is brought to you by Edna Digital Marketing. Now, I have Dr. Tang Ho here, who is Chief of Facial Plastic and Reconstructive Surgery and an Associate Professor in the Department of Otorhinolaryngology, Head and Neck Surgery at University of Texas Health Science Center in Houston. He is also the director of the Facial Plastic and Reconstructive Surgery Fellowship Program. Prior to embarking on a career in medicine, Dr. Ho was a U.S. Fulbright Scholar to the United Kingdom, where he received his master's degree in sociology from the University of Edinburgh in Scotland. He is also double board certified by the American Board of Facial Plastic and Reconstructive Surgery and the American Board of Otolaryngology, Head and Neck Surgery. Welcome, Dr. Ho. Glad to have you here.
Daniel, it's good to be here, and excited to be on this podcast and share with whatever knowledge that we can share with the audience.
Perfect. So let's dive right into it. Dr. Ho, I'm curious, how did you actually get interested in the aesthetics industry?
Yeah, so I think, this is probably a question I'm sure a lot of us get, asked. And I think similar to probably what a lot of the other people I've talked about, for me, it's the immediate gratification and being able to kind of really see the outcome of essentially the work that you have done, whether it be minimally invasive procedures or surgery, on the table. And I think, especially when it comes to plastic surgery, there is, without a doubt, an artistic component to what we do, right? And so there's variability between how each surgeon and each practitioner actually approach the problem is question, and whether it's wrinkles or it's a hump on the nose and so on. And, being able to effect these changes and really be able to kind of see the outcome right away. And obviously having satisfied and happy clients and patients, I think all these factors combined is really what makes this really rewarding for me personally, I think for a lot of us as well.
No, that's great to know. Now, when it comes to you talked about plastic surgery, I know you do a lot of different types of treatments and procedures. What would you say is the most common type of treatment that you do for your patients? Or why do you think that that's the most common one, or I guess the most popular?
Yeah, so I specialize in facial plastic surgery, and it's always fascinating to me when you look at the face, because if you actually think about the difference between all of our faces, it's really not that different in that sense, right? Because we all have two eyes, we all have a nose, we all have a mouth, we have two ears, right? Mm-hmm. So the difference between, like, say, all the very intricate parts of the face, but allows you to distinguish between the different faces. I think it's really quite fascinating when you think about it, because you always recognize, you're never going to really mistaken your parents for really somebody else, right? So whether it be a doppelganger or something, when we see these, like similarities and so on. But going back to kind of what you're asking earlier, I think the minute details in the face is really kind of what makes me really kind of interested in doing facial plastic surgery. So in the sense that, we are able to really kind of make a big difference by really kind of effecting sometimes what seems like a very small amount of change. For me, I really enjoy doing a lot of rhinoplasties and also eyelid surgeries. And although these days, the minimally invasive office-based procedures are also becoming more and more common as well. And to me, I've also enjoyed doing that as well. For example, threads And that's something that's becoming really popular in appropriate patients. And so a full range of things, anything from surgical rhinoplasty to facial rejuvenation procedures to minimal invasive procedures.
Got it. Now, you brought up the point where you're doing the traditional plastic surgery, also more of the non-invasive. What would you say would be kind of the biggest differences between those two for someone who is maybe looking for a certain type of procedure, they want to look younger, and they're not quite sure exactly, is the plastic surgery the right fit for me, or is the non-invasive procedure a better fit for them? How would you make that distinction for that particular patient?
Yeah, so what I always tell my patients and my clients and so on is that I really view myself, partially because I'm in academic practice, I really view our role as physicians and surgeon in this practice as more of an educator. And my goal and my role is to let my patient know what are the appropriate treatments, whether it be minimally invasive or surgical, right? Now, for some patients, if they have a pretty significant amount of aging changes, then minimally invasive options may not be the best option, right? Because it's only going to result in a small amount of change versus the amount of change that's needed to make the patient happy or to achieve what their goal is going to be much more. Mm-hmm. So it's really a combination between what the patient is looking for, mm-hmm. and also how essentially how much difference that the patient or the client is looking for.
Okay, so really it's what's their end goal, I guess, to what degree do they want to have those changes made, and then finding the right treatment or procedure that fits that scenario, correct?
Correct, exactly, yeah.
Now, I'm sure that you get some situations where some people come in and they have the conception that, oh, I want this, but maybe it's not the best fit for them, or they come in where they have no idea what they want. They just know, I want to look younger, I want to get rid of these wrinkles. What can you do for me? So could you talk a little bit more about how you approach educating those patients across kind of the spectrum, depending on whether they have an idea already in mind and it's not the right one, or they have no idea what they're really looking for, they just know the end result?
Yeah, so a lot of times I think for these, so some before and after photos that we have of some previous patients that had the treatments are often useful in kind of explaining. I think a lot of times a picture is worth 1,000 words. And a lot of times it's also kind of going back to what I was saying earlier, is about education as well. And I think a lot of times, at least for me with my patients, I have found it to be pretty helpful to essentially go through the pros and cons of each treatment options, because nowadays, of course, before someone comes in, most of the people would have already done the research on the internet. And the issue with looking for information out there on the internet is that a lot of times you're getting the information that you're looking for, mm-hmm. right? So in the sense of that, if you want something to be the right thing for you, you're going to end up finding the information that's going to support what you're thinking. Most of the time I find that to be true. But I think the role that we play is that to try to be a more objective evaluator in kind of letting patients know, there are these advantages, but you also do have to keep in mind what are some of the downsides perhaps with the option that you're looking for. And I find a lot of times that people will come in and they will know all the pros of the option they're looking for, but they haven't thought about or haven't seen any of the cons of the option that they're looking for. For example, if they're looking for threads, they may have heard about all the positive and so on about threads, but they may not have actually seen or heard about any of the negatives or potential things that need to be concerned for. And the same thing with surgery as well. With surgery, a lot of times the patient will be like, oh, I just can't imagine surgery will be for me. But once we kind of go through and explaining what's about it, and then what kind of the improvement they can achieve from surgery, and then they will come around and think about it, and then maybe surgery is really what I need or looking for. So.
Okay, got it. Now, I think you brought up a very good point there, Dr. Ho, where it's like people go online and they find the evidence to support what they think. It's almost like that joke where people go on WebMD and they try and figure out based on their symptoms what they have, and by the end of it, they have this super rare disease that no one else has heard of because they
right.
That. So that's a little bit of a joke, but I mean, I'm sure, as you mentioned, you see this happen. But what do you think are some of the most common misconceptions your patients have when they come to you about the treatments that you provide? What are some of those most common ones that you see?
Yeah, so a lot of the misconception, I think, when it comes to something like surgery, for example, right? I think a lot of times people, when they think about plastic surgery, I think a lot of times they think of, for example, rhinoplasty. They think about being black and blue and have a lot of bruising around the face and so on. And, and that is possible. You can get that. And you'll definitely get some bruising and so on. But for example, rhinoplasty, the quoted number for bruising is about, that's pretty visible, is probably about 30-40%. So not everybody's going to get those, right? And then so on the contrary, for the minimally invasive options, a lot of times people think that, they can basically get it and there's absolutely no downsides and there's no recovery, no bruising, nothing. And that's not true, right? So for example, when you're getting some Botox, even just around the eyes, and you can get some bruising around the eyes that can be fairly visible, or if you get some fillers around the tear trough, that can be resulting in some bruising around the tear trough as well. So I think a lot of times it's kind of along that lines of, as far as misconceptions go about, kind of what to expect with the different treatments. I find that to be most the case.
Got it. Now, Dr. Ho, I want to go dive a little bit deeper more, since I find that your situation is very unique, is that you're part of academic practice, being part of the University of Texas. So would you talk a little bit more about how that really, I guess, sets you apart, or how your approach is a bit different, given in mind that you are part of an academy?
Yeah. So, academic medicine also has changed quite a bit. But one thing that I always kind of tell my colleagues a lot of times is that I think my colleagues have a perception of me being academic medicine and essentially being this professor and all I do is teaching. And, really nowadays, academic medicine is not, I think, in a lot of different ways, different from private practice, clinical medicine in some ways. But I think the thing that still really distinguishes being academia is that, we are constantly in touch with essentially the newest research and the newest advancements in the field, whether it be reconstructive surgery or aesthetic surgery, and also having trainees around also constantly essentially keep us on our toes to a certain extent, right? Because they're always learning from us. We're also training the next generation of plastic surgeons that are going to be out in the community treating other patients. So having that obligation, I think, also puts us in a position to be even more cognizant of what we are doing and what we're teaching and offering to our patients. So that is one aspect of it. And the other aspect, I think, being academia, kind of along the same line, is that we are always going to be a fiduciary to our patients, right? And so we're always going to And that is true, I think, really for all physicians, but, especially in academia, you know, having the trainees around and having them keeping us on our toes, we always want to make sure that we are doing what is best for the patient, and and that's where I think another thing that always, we always keep that in mind.
Okay, got it. Now, there's another thing also, like that's one big thing that I know that makes you different from a lot of other practices out there. But I know we were talking earlier, and you actually even do reconstruction for cancer and trauma patients, which is something that I really haven't heard a lot of people doing. Would you mind elaborating a little bit more on that, what you do for those types of patients?
Yeah, so we because part of being academic practice, and we're also part of a large hospital that sees a lot of trauma patients, and so we treat a lot of patients that have are either essentially recovering cancer patients that had cancer surgery. They need additional reconstruction on the face from the cancer resection on the face, or trauma patients such as gunshot wounds or motor vehicle trauma, and that needs reconstruction. So we definitely get, quite a bit of that as well. And I think for me, as a facial plastic surgeon, I think being able to do both the aesthetic and the reconstructive aspects are mutually complementary, in the sense that I think having the aesthetic sense helps me in my reconstruction of patients who need a reconstructive surgery. And at the same time, doing a lot of these complex reconstructive surgery, I feel also helps to sharpen my skill set, and also helps me to kind of develop a new set of eyes in patients who come to me for aesthetic treatments as well. For example, some of the reconstruction that we do are things such as, people who had their tongue or jaw removed, and we will have to transplant tissue from the arm or from the leg to make a new tongue or a new jaw. And that's essentially like a transplant type of surgery, where we will transplant the tissue and the blood vessels that go with it, and then connect the blood vessels into the neck so that you can essentially come alive with new blood supply from the neck, and then forms into a new organ such as a tongue or jaw or nose and so on. So I think having that skill set also allows me to develop a different level of appreciation in my aesthetic patients as well.
Yeah, I mean, that's incredible, having to be able to do all that for patients, especially the trauma patients. And that kind of leads me to my next question, is that since you're getting kind of a wide array of patients, the cancer patients, the trauma patients, more the aesthetic, like just looking strictly for the aesthetic side. So how do you balance providing that relaxing experience for your patients, but also at the same time ensuring their safety and well-being during these procedures or these treatments?
So, Daniel, you mean like during the surgery or during the?
Oh, like leading up to it, during, after, just like making sure that they're relaxed. I'm sure some of these people come in and they're very nervous.
Oh, okay.
I got sure what to do. And like, I guess, how do you approach that to balance that, them having good experience, but also making sure that the safety, the well-being is there, kept in mind for them as well?
Yeah. So, and like you said, so the experience of, whether it's, for aesthetic surgery or for reconstructive surgery, the patients at the end of the day, they're undergoing through an invasive procedure. So the recovery that they will be going through, in some ways are somewhat similar in some ways. So I think it's always helpful for the patients to kind of know what kind of procedures they had. A lot of times they are relaxed and are more comfortable once they kind of know exactly what have been done. And so we'll explain that to the patients if there was something, because usually right after the procedure, the patients are still waking up in the recovery, and we explain to the family members and so on. But the family member really, a lot of times, may not have the same kind of things, can get lost in translation and talking about. So when the patients come back for a follow-up after surgery, that's one thing that I make sure we explain to the patients so that they understand what exactly they had. And the same thing for our aesthetic patients who are undergoing, non-invasive treatment. I think also explaining to them exactly what to expect and what is to come is helpful for the patients, for them to be more relaxed and also more comfortable with the whole treatment experience.
Got it. Now, I'm sure like the way that you've explained how you provide this experience to your patients, your background, it sounds like there's a part of like an artistic part that goes into it. It's not just pure science, there's also a little bit of art that goes into it. But what do you believe is the role, or what role does creativity play in how you approach these procedures or the patient care?
Yeah, so I think there is definitely, especially when it comes to the aesthetic side of things, I think there definitely is a requirement for you to develop essentially an artistic eye for things. And that's where, having done this for about 15 years now, so that I think definitely experience helps a bit. But, even for something as simple as like fillers and Botox and so on, knowing where to place the filler and the Botox based on the patient and based on what we see, and being able to adapt, because not everybody has the same face, right? So when we go to courses and when we teach courses, there are certain basic principles that we teach, but it's important for us to really look at everyone and really not try to just approach it like a cookbook kind of approach, where just, if it's Botox, then just do 2 rows of injection. Some people may need a different pattern of injection based on where the wrinkles are and how severe the wrinkles are on the forehead, for example, in patients who are getting something as simple as Botox, right? And same thing with the fillers. When we're doing fillers for the nasolabial fold here, the fold can be, the depth can be different, and the depth and the fold sometimes in certain people can extend a little beyond the corner of the lip, and that may require some different techniques and different ways of actually achieve the best result. So I think these are all part of what I think of as being kind of artistic and try to adapt to each individual patient and client's needs and what their goals are.
Okay. Now, you must have had some pretty challenging cases throughout your career. Are there any that really stand out to you, like a very challenging case, and how you were able to get them a successful outcome?
Yeah, so I remember this young lady that having had a pretty severe injury to the nose, as when she was a cheerleader, actually, and she was a cheerleader, and she was essentially lifting another person on the team, and unfortunately she essentially fell, and then the kneed her in the nose, and her nose was literally just smashed into pieces. And in this case, so it was a pretty challenging case, and she also was very obviously, understandably, traumatized by the incident, which is totally understandable. And she had also seen several providers, has seen several plastic surgeons, eventually decided to have the rhinoplasty, both the cosmetic and the reconstruction component with us. And so for her, I harvested a rib and used the rib to essentially rebuild the bridge of the nose, and also the portion close to the front to help project the nasal tip. And in her case, because we want to always get the best aesthetic outcome, so even though the injury was on the nose, but in order to achieve the best overall aesthetics, she would have benefited from a chin implant as well. So we did a chin implant, but rather than using the standard silicone, we took some of the bone that was had to be removed from the reconstruction and used that, essentially shifted that over to make a chin implant from the bone of the nose for her, and then reconstructed her nose with a piece of rib cartilage. And so that case, for some reason, it has kind of always stuck with me. I think partially because it really is, I think, going back to what I was saying, essentially a meld of both the reconstructive and aesthetic needs of the patients are met. And that's kind of the case, I think, that really challenges me to constantly think of like better ways of doing things, and whatever that needs to be done to essentially provide the best outcome for the patient.
Wow, that's a great story. I mean, she must have been thrilled by the time you
Yeah,
finished.
she did great, and I was very happy, and we're very happy that I was able to help her. So
That's great. Now, you mentioned a little bit about how the care is changing, the treatments are changing, everything is evolving. Like, where do you really think the future of aesthetics is going? I guess, what do you think is like the next step for it, or the next greatest thing that's going to come out of it?
yeah, so that's a great question. I think there's always what I have having been around for a while. I think what we're going to see is rather than something kind of totally earth-shattering or totally different. I think what we're going to see is essentially refinements of some of these older technologies that have been around and that have had been essentially seeing some benefits, but were either kind of tabled or not as popular because of certain issues. But now, because of advancement in science and technology, these older technology which are already being approved are being refined. I think the best example is probably the radio frequency technology, or the RF, right? So now we kind of see different variations of radio frequency that are now being on the market as being offered, things like phase type, body type, and Morpheus, these kind of different essentially under different names. But radio frequency actually is a technology that has been around for a long time. Even when I was in training over 20 years ago, it has already been around. But the issue with the technology was the delivery of radio frequency was not very predictable. So the heat that is being essentially generated is harder to control. So you end up getting somewhat uneven heating, and then therefore the tissue can scar, and therefore resulting in sometimes unwanted divots or bands on the skin, depends on where it was being used. But now, because the technology with delivery of the radio frequency is much better, so you see that radio frequency is being brought back again, but now being packaged under different names with a different delivery device. And I think that's probably more likely to be the trend, is that we end up not so much recycling the old technology, but the older technology are being brought back, but are being improved upon, whether through like the delivery device or some other aspect of it. Because the problem with something that's totally earth-shattering, such as things like stem cells or, a lot of these kind of other things, is that in order to go through the approval process, there needs to be a lot of investigation that has to go into it before we can make sure that it's 100% safe for everybody. And that's going to take time, and it's going to take a lot of investment. So I think in the immediate future, we're more likely to kind of see more of these technology that have been shown to work, but maybe have not been as popular, and then essentially getting some improvement and essentially getting a new breath of life into it under different names, and then actually working out really well for people. I think that's probably where it's actually we will probably end up seeing more of these.
Okay, got it. That's interesting. Yeah, well, I guess we'll see what happens in the future, but that's a very interesting perspective on it, on how things may be changing in the aesthetics industry. Now, Dr. Ho, I have one last question for you, but before I ask that, I want to point people to your website at www.texasfacialplastics.org. My last question is, what is your most important piece of advice you can give to somebody who's maybe on the fence about getting some type of aesthetic procedure done, but they're a bit hesitant, either maybe because they've heard horror stories about it, or they just don't have the information, or there's something holding them back? What would be your best piece of advice you would give to someone like that?
Yeah, I think kind of goes along with what we have kind of talked about in the last 20 minutes or so. I think the key really for that is to find a provider that you trust, whether it's like word of mouth or just information that you find elsewhere and referrals by another physician. I think you can get a lot of information. Of course, nowadays especially when it comes to aesthetics, things like Instagram, TikTok, social media, it's everywhere, right? So, and definitely there's definitely benefit in kind of getting some information from some of these sources. But I think at the end of the day, as I was kind of discussing earlier, when you're looking at these outlets, you're more likely to end up finding information that's just going to further kind of solidify what your pre-existing notion of about this treatment option. Mm-hmm. And nothing is going to replace going in person, or at least having video consult with a surgeon or a aesthetic provider that you trust, and have them give you their honest assessment and opinion. And a lot of times these will require some hands-on, actually exam. So, for me, I still like to actually feel the skin texture of my patient, feel how much laxity there is by putting my hand on the patient. Nothing is really going to beat a personal encounter where you have the chance to actually do that. But regardless, I think talking to a knowledgeable professional in the aesthetic industry, I know you've had a lot of great guests on your show, and I think someone that is knowledgeable and can provide you with unbiased, honest assessment, I think there's no replacement for that.
Great. Well, there you have it. Dr. Ho sharing his experience with everybody. Now, Dr. Ho, where can people contact you and your practice?
So we're located in the Texas Medical Center, and our address is 6400 Fannin on the 20th floor, Suite 2080. And our phone number to call and make the appointment is 713-486-5019. And the website address is, as you mentioned, www.texasfacialplastics.org.
Great. Well, thanks for being on the show and sharing your message.
All right. Thank you, Daniel. Thanks, everybody.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.